Today we're going to demonstrate how to do manual muscle testing for the upper extremities. Manual muscle testing is an art and a science of testing muscles, one of many tools to evaluate a patient's muscle abilities. The clinician will grade the tested muscle from 0 to 5. 0 is no observable contraction, there's no movement. 1 would be that there's movement detected, but no joint movement. This would be like a twitch. 2 is there is movement of the joint, partially against gravity, but could be with full range of motion with gravity. 3 is full range of motion against gravity. 4, the patient withstands moderate resistance while the muscle contracts. And then 5 is the patient withstands maximum resistance while the muscle contracts. During the test, the clinician will provide resistance while instructing the patient, hold, don't let me move you, sometimes with encouragement. This video is for instructional purposes. Remember to always ensure that your patients are comfortable during the testing using proper body mechanics.
The next muscle is the supraspinatus. The action of this muscle is abduction. To test this muscle, place the elbow into slight flexion and apply pressure to the outside of the arm, trying to force the arm into adduction. Hold, don't let me move you. The next 3 muscles are the anterior deltoid, middle deltoid, and posterior deltoid. The actions of the anterior deltoid are flexion, horizontal adduction, internal rotation, and abduction. The action of the middle deltoid is abduction. The actions of the posterior deltoid are extension, horizontal abduction, and external rotation. To test the anterior deltoid, place the arm into slight horizontal adduction and apply pressure down and back. Hold on, let me move you. To test the middle deltoid, place the arm into abduction and apply pressure down, trying to force the arm into adduction. Hold, don't let me move you. To test the posterior deltoid, place the arm into slight horizontal abduction and place pressure forward and down. Hold, don't let me move you. The next muscle is the infraspinatus. The action of this muscle is external rotation. To test this muscle, place the elbow into slight flexion and apply pressure to the distal forearm, trying to force the arm into internal rotation. Hold, don't let me move you. The next muscle is the subscapularis. The action of this muscle is internal rotation. To test this muscle, a towel can be held at the patient's side under their arm to achieve the desired action. Then apply pressure to the inside distal portion of the forearm, trying to force the arm into external rotation. Hold, don't let me move you. The next muscle is the teres minor. The action of this muscle is external rotation. To test this muscle, place the arm into slight abduction and flexion. Apply pressure to the distal forearm, trying to force it into internal rotation. Hold, don't let me move you.
The next muscle we are going to test is the coracobrachialis. The actions of this muscle are flexion and horizontal adduction. To test this muscle, place the arm into flexion and slight horizontal adduction and apply pressure down and out.
Hold, don't let me move you.
The muscle we are going to your scapula. The action of this muscle is elevation and downward rotation of the scapula. To test this muscle, place the shoulder into slight retraction and apply pressure downward on the superior aspect of the scapula.
Hold, don't let me move you.
The next muscle is the upper trapezius. The action of this muscle is elevation and upward rotation of the scapula. To test this muscle, elevate the shoulder and apply pressure downward, trying to depress the muscle.
Hold, don't let me move you.
The next muscle we are going to test is the serratus anterior. The action of this muscle is scapular protraction and upward rotation. To test this muscle, we try to push the scapula into retraction.
Hold, don't let me move you.
The next muscle we are going to test is the bicep long head. The action of this muscle is flexion. To test this muscle, place the arm into flexion and apply pressure to the distal forearm and try to force the muscle into extension.
Hold, don't let me move you.
The next muscle we are going to test is the bicep short head. The action of this muscle is flexion. To test this muscle, place the arm into elbow flexion and apply pressure to the forearm and try to force the muscle into extension.
Hold, don't let me move you.
The next muscle we will be testing is the pectoralis minor. The action of this muscle is scapular depression, anterior tilt, and downward rotation of the scapula. To test the muscle, have the patient lying in supine with the shoulder lifted off the table while applying pressure to the coracoid process.
Hold, don't let me move you.
The next muscle we will be testing is the pectoralis major. The action of this muscle is internal rotation, flexion, and horizontal adduction. To test this muscle, lie the patient in supine with the arm in flexion and fist facing up. Apply the pressure on the distal aspect of the humerus down and back.
Hold, don't let me move you.
Action.
The next muscle we will be testing is the teres major. The action of this muscle is extension, adduction, and internal rotation. To test this muscle, lie the patient in prone with the arm placed into internal rotation, applying pressure downward.
Hold, don't let me move you.
The next muscle we will be testing is the middle trapezius. The action of this muscle is scapular retraction. To test the muscle, lie the patient in prone with the arms straight out to the side and thumb facing up, applying the pressure downward into scapular protraction.
Hold, don't let me move you.
Action.
The next muscle we will be testing is the lower trapezius. The action of this muscle is scapular depression and upward rotation. To test this muscle, lie the patient in prone with the arms straight out with slight abduction, with the thumb facing upward, applying the pressure downward into scapular protraction.
Hold, don't let me move you.
Muscle is latissimus dorsi. The action of this muscle is extension. To test this muscle, place the arm into extension, Pressure is applied downward to force flexion.
Hold, don't let me move you.
The next muscles are the triceps. The action of this muscle is elbow flexion. To test this muscle, place the forearm into flexion and support by holding the elbow. Pressure is applied to the forearm, trying to force the arm into flexion.
Hold, don't let me move you.
The next muscle we're going to test is the brachioradialis. The action of this muscle is elbow flexion. To test the brachioradialis, you need the arm flexed at 90 degrees with the thumb pointed towards the shoulder. Pressure is applied to the distal forearm, trying to force the elbow into extension.
Hold, don't let me move you.
The next muscle is the supinator. The action of this muscle is forearm supination. To test this muscle, place the arm into flexion and hold the wrist. Pressure is applied throughout the wrist, trying to force the arm into pronation.
Hold, don't let me move you.
Muscle is the pronator teres. The action of this muscle is forearm pronation. To test this muscle, place the arm into flexion and hold the wrist. Pressure is applied through the wrist, trying to force the arm into supination.
Hold, don't let me move you.
The next muscle is the extensor carpi radialis brevis. The action of this muscle is wrist extension. To test this muscle, place the wrist into slight extension. Pressure is applied to the third metacarpal, trying to force flexion.
Hold, don't let me move you.
We might want to read. The next muscle is the extensor carpi radialis longus. The action of this muscle is wrist extension. To test this muscle, place the wrist into slight extension. Pressure is applied to the second metacarpal, trying to force flexion.
Hold, don't let me move you.
Next, we will test the flexor carpi radialis. Its action is wrist flexion. To do this, we will place the wrist in flexion and put pressure at the second metacarpal, trying to force extension.
Hold, don't let me move you.
Flexor carpi ulnaris. Its action is wrist flexion and ulnar deviation. To test this muscle, we will place the wrist in flexion and put pressure on the fifth metacarpal, trying to force extension.
Hold, don't let me move you.
Next is the flexor digitorum superficialis. Its action is flexion of MCP and PIP joints of digits 2 through 5. To test this muscle, block the MCP and apply pressure at the palmar aspect of the middle phalanx, attempting to extend fingers.
Hold, don't let me move you.
Next, we will test the flexor digitorum profundus. This muscle's action is flexion of MCP, PIP, and DIP joints of digits 2 through 5. To test this, we will block MCP and PIP joints, and pressure is applied to distal phalanx, trying to extend.
Hold, don't let me move you.
This is the palmaris longus. Its action is wrist flexion. To test this muscle, we will move the wrist equally into extension, opposing its function of flexion.
Hold, don't let me move you.
Lumbricals. They are responsible for the flexion of the MCP while extension of the DIP and the PIP joints. This is tested by the patient holding onto a paper while the clinician tries to remove it.
Hold, don't let me move you.
Interosseous dorsal is responsible for finger abduction at the MCP joint. This action is tested by the patients extending their hand, fingers spread. The clinician places their hand on either side and the patient attempts to adduct their fingers.
Hold, don't let me move you.
Interosseous palmar. These muscles are responsible for finger adduction at the MCP joint. This time, with the patient's palm extended and fingers spread, the clinician interlocks their fingers at 90 degrees and asks the patient to keep them from removing their fingers, the patient adducting their fingers in resistance.
Hold, don't let me move you.
Adductor pollicis. This adducts the thumb at the CMC joint. To test this muscle, place the thumb in a neutral position. The clinician applies pressure to the proximal phalanx, causing abduction, while the patient adducts.
Hold, don't let me move you.
Extensor digitorum. The action of this muscle is to extend the MCP, PIP, and DIP of fingers 2 through 5. To test this muscle, apply pressure to the proximal phalanxes of 2 through 5 and try to force them into flexion.
Hold, don't let me move you.
The next muscles we're going to test are the opponent's digiti minimi and the opponent's pollicis. The action of the opponent's digiti minimi is the opposition of the fifth digit. The action of the opponent's pollicis is the opposition of the first CMC. To test these muscles, the patient will oppose the first CMC and fifth digit, and the clinician force them into reposition.
Hold, don't let me move you.
The next muscles are the adductor pollicis longus and brevis. The action of the longus is abduction and extension of the first CMC. The action of the brevis is abduction and flexion of the CMC, B, and CP. To test the longus, apply pressure to the distal first metacarpal.
Hold, don't let me move you.
To test the brevis, apply pressure to the distal proximal phalange.
Hold, don't let me move you.
The next muscles are the flexor pollicis longus brevis. The action of the muscles for the longus is flexion, CMC, MCP, and IP flexion. For the brevis is flexion of the MCP and CMC. To test the longus, apply pressure to the distal phalange of the thumb, trying to force extension.
Hold, don't let me move you.
To test the brevis, apply pressure to the proximal phalange of the thumb, trying to force extension.
Hold, don't let me move you.
The next muscles are the extensor pollicis longus and brevis. The action of the longus is extension of the CMC, MCP, and PIP joints. The action of the brevis is extension of the MCP, CMC joints. To test the longus, apply pressure to the distal phalange of the thumb to force flexion.
Hold, don't let me move you.
To test the brevis, apply pressure to the proximal phalange of the thumb, trying to force flexion.
Hold, don't let me move you.